Hello, everybody. Welcome to the Next Level podcast. So I am your host and co-host, Alex. I'm Dave. I'm not Alex. I'm Dave. Dr. David Kwan. This is Dr. Alex. So we're really excited to be starting the Next Level podcast with you guys. We're going to be going over a bunch of content. Not today, but in future broadcasts, we're going to go over physical therapy topics. We're going to go over concussion stuff. We're going to go over neuro rehab. We're going to go over nutrition. We're going to go over fitness, health, triathlons, you name it in relation to what Next Level does. We are going to cover it. So let me introduce myself. I am Dr. David Kwan. I've been a physical therapist for like 11 years. To include school, like 14. I've mostly worked in kind of sports-related outpatient orthopedics. A lot of athletes, a lot of professional athletes, to everyday weekend warrior looking to get faster in that 5K or that triathlon. I've got 3 kids, so I got my hands full. But we're excited about what the future holds for Next Level and this podcast. I am the GM at Next Level, so you will see me often if you ever come in through the doors. This is Dr. Alex. I'm going to let Dr. Alex introduce himself.
Hey everyone, Dr. Alex Geisfieler, like Dr. Dave had mentioned. I'm a physical therapist also at Next Level Physio. I haven't been a physical therapist as long as Dr. Dave, but I graduated from the Mercy College DPT program. Prior to that, I was a NASM certified personal trainer and an NSCA certified strength and conditioning coach for approximately 10 years. I'm also a published author and contributor to a series of health and athletic exercise books published by Thunderbird Press. And yeah, just like Dr. Dave mentioned, we treat everything from the weekend warrior with like a mild sprain through vestibular issues, different pathologies, cognitive, musculoskeletal. So we kind of run the gambit, and really also kind of big, wide age range, from some youngins to some,
not so youngins.
Not so youngins. Yeah, is that the proper way to say it? Yeah. And just like Dr. Dave said, I am super excited to be part of this podcast and bring you some awesome content that I think is pretty exciting.
Awesome. So the topic of today is, what is physical therapy, and what do you need to know about physical therapy? So Next Level Physio, the physio part is basically saying that we're a rehab center. And what is rehab? What is physical therapy? Alex, you wanna dive into that a bit?
Sure. So like, what is a physical therapy? And this is a really hard question to define, as like physical therapy is a practice that really incorporates a multitude of like holistic strategies and conservative methods with the main focus of optimal kinesthetics or movement. So a definition I came across is that a physical therapist is a health specialist who evaluates and treats human body disorders. And I think that's a very like superficial and vague description. The APTA or the American Physical Therapy Association has a different definition that says physical therapists are movement experts who improve quality of life through prescribed exercise, hands-on care, and patient education. And I believe this definition is a little more to the point. I think it really requires all 3 of those components that they described, like the prescribed exercise, the hands-on care, and what's really important and what I don't think gets utilized enough maybe is that patient education.
Yeah, I think what I always say to my patients, it's like all other health professions, well, not all other health professions, but a lot of other health professions, especially in Western medicine, you're trying to use external things like medicine, like injections, to fix some problem that's going on in the body, right? What I often explain to people is that physical therapy and physical therapists, what our job is to do is to let the body heal itself, put it in an optimal situation, in an optimal position that the body can actually use its own mechanisms to fix what's going on. We use exercise. If we look at the research, exercise is one of the most powerful tools we have to produce change endogenously in the body, to be able to create a situation where the body can heal itself and repair whatever damage that has existed by creating an optimal situation for it, whether it's through manual things that we're doing, whether it's mobilizations or other manual work that we're doing, or using other modalities to kind of stimulate or stir the pot to be able to get to a situation where the body could heal itself.
And much to, like you alluded already, so many times have we heard, countless that, Western medicine is kind of, or the doctors are treating something with medication or an injection or surgery, which oftentimes doesn't, through meta-analysis or like the research has shown that it's kind of a 50-50 shot whether it works or doesn't. However, it's more like, and to use a cliche term, like a Band-Aid over a wound where there's a cascade of issues happening. And that really just kind of plugs one hole before another hole shows up. Whereas I think as physical therapists, the idea is to really bring it back down to the foundations and build from there so that you have a good structure to build off of.
Yeah. I think about, a lot of times what happens is you start playing whack-a-mole, or you feel like you're putting Band-Aids, or like you feel like you're putting fire out with a little bucket. The fact of the matter is that there's probably some underlying, not pathology, there might be some underlying root cause of whatever orthopedic issues this person is going through, right? And what we often see is a patient comes in, they've seen 3 physical therapists, they've seen 2 physiatrists, they've had 3 injections, and they're like, it's not, they might feel a little bit better than they did 3 years ago, but it hasn't fixed itself. And that's what people all often think. They think that their body is just going to fix itself. It's usually just going to go away. And that is probably the case if you're 16. But what happens is that you actually set yourself up for failure because you didn't address the issues that really precipitated the injury that is now presenting itself now. So when we put Band-Aids on it, medication, or, use vitamin I, ibuprofen, popping pills every day, that's just covering up the signaling that's coming from your body saying hey, there's something wrong here. We need to address it. I'm sending this pain signal to you. And you are covering up those signals, Sure.
And there's obviously a time and a place for some of those things. But I think too often that's the first stop on the way. It's why wouldn't you go more conservatively first? But
yeah. And I mean, things I'm guilty of, and I think that ibuprofen has a time and a place. But if that's your number one go-to and that's your only solution for whatever things are going on with you, then you're probably not doing the right thing. So that's what rehab is, right? People think of rehab as like, you get some hot packs and you get some cold packs and maybe get some stim or a massage. And I get that all the time. Like, oh yeah, I just need a massage. I think if I just massage it out, it's going to get better. But what are those things that are causing those muscles to be tight, right? Is it your position? Is it your sleep, situation? Is it you're dehydrated? Is it you're overly stressed at work? Like there has to be some root cause as to why that one muscle in the back of your shoulder is always tight. And that's what our job is as physical therapists, is to figure out what that is. Like, what are those precipitating causes and what are the root causes of whatever, pathology or issue that you're dealing with, and how do we fix it?
So now that you like kind of bring that up, like what's a like what should we look for in a PT clinic or like a good physical therapist?
That's a great question. I think that communication and education are probably the primary things. Not education of like the therapist, but is the therapist taking time to educate you about what the situation is? And that's the thing that like patients tell me all the time, like, oh, you know what? No one ever told me what I have or like what's going on. They just told me to go to physical therapy. Or like, no one ever told me like exactly what a herniated disc is. And no one ever told me like that breathing affects your position or whatever. So I think that one delineation is that if you're not being educated by your physical therapist, that's going to be a problem.
Absolutely. I think, I mentioned before, but that definition of the APTA is that patient education is so critical. And we were talking about it, that something has happened or something that you are doing that, has led you to this moment. Mm-hmm. Could have been a trauma, could have been not your fault. However, something happened to bring you here. How do we fix that? And if you are reliant on medication, a doctor, even a physical therapist, if you are seeing, going to rehab and you are completely relying on that person, how you'll never get, better or fix the holes in your game, from just someone working on you 2 to 3 times a week. You have to do it, and make it a lifestyle.
Yeah. I'm a firm believer that we as physical therapists, one of our primary roles is being a teacher. Kelly Starrett, in his introduction to his book, Mobility WOD, The Supple Leopard, I'm sorry. That's a good book.
Great book.
It was one of those books that like really showed me that as a physical therapist or as a rehab specialist, that I'm a teacher first and foremost, right? If I'm not teaching my patient something new about their own body and how to fix it, then I've failed at my job. And also, I think that something that delineates a good physical therapist or a good physical therapy place from a quote unquote bad one is that time aspect. Are you able to spend time with the patient? A lot of times you hear, oh yeah, I saw the physical therapist for, 5 minutes and then I was with an aide for the rest of the time, or I was, by myself, or I was just on heat and stim. And, there's a time and place for those things, but how can you educate somebody if you don't have the time with them to educate them, right?
Absolutely.
So I think that, that teaching aspect and that time aspect is one of the delineations. What else do you think, Alex, is another delineation?
So that kind of leads into another thing of several times we'll either have people come to us who've had physical therapy before and, have been to, let's say, a clinic or a location that treats them more like blocks on a schedule, instead of actually listening to them as a patient. And you should really feel, if you're in rehab or you're going to physical therapy, you should really feel like the physical therapist is in this with you. They're empathetic. They're there. They've heard your story. They're as interested in achieving your goals as you are. And so something that you kind of brought up is my father had a total knee replacement about 2 years ago, something like that, and he initially met with the physical therapist, and then afterwards was handled by an aide, a physical therapy aide, for the rest of his care. To the point where he thought the physical therapy aide was his physical therapist, and that is more a comment on how great the aide is. So good for her. That's fantastic. However, you should really be in there. Like, it should be a daily conversation. Every time you're in there, you should be meeting with that physical therapist to talk about your progressions, your regressions, pains that have shown up, and how your progress is going.
Yeah. I think that what you said about goals is like the biggest thing, right? So, I mean, I've worked in other physical therapy places, and some good and some bad, and the emphasis on the patient's goal being the primary focus is something that really sets next level and apart from other places. In that, you got that 75-year-old guy, total knee replacement, wants to go play golf, right? Another PT place might be like, we'll get your range of motion back to good, and we'll get your strength back to 5 out of 5, and we'll get you walking, okay-ish.
Ish, yeah.
But if you want to play golf, like, go, you try. No, like, we're gonna actively work on golf. We're going to work on golf movements. We're going to work on your ability to get up and down a hill. We're going to work on your ability to pivot and turn through the hip. And that integration and that understanding of being a strength and conditioning coach like yourself and myself kind of ties into building programs around whatever the patient's goals are, rather than focusing just on, manual muscle tests and range of motion and, girth measurements of someone's knee. I think that's one of the main things that really differentiates us, and what differentiates a good PT place from a not so good PT place is that emphasis on your goals and your ability and our ability to achieve that goal.
Absolutely. I think, the majority of our patients are striving to do something, that we see here at Next Level, but it doesn't have to be a big thing, like whether it's, running a race, performing a triathlon, but, you could even think of it as like yard work or lifting, playing with your children. If that's a goal that's important to you, it's crucial that that's part of your rehab, and that, your strengthening, your conditioning, and your mobility is all geared towards those things. Not only being within good limits or having good range, but that you can actively do those things. Because we all know, just because you've got good range of motion and relatively like good strength, if I push down on your arm, that doesn't mean you can lift your kids. That doesn't mean you can go out and yeah. So I think if your physical therapist doesn't take your specific passions and goals into effect, then that's not so good.
Yeah, I completely agree. And behind you, Alex, you could point to it. Our motto is move, excel, inspire.
Oh, on this side,
right?
Yeah.
And those three words are very important. Right. Because it kind of sets up the model of like what we're about and what rehab really should be about. Move means get you back moving, right? Very basic, foundational. You're injured, you weren't moving. Move, rehab, you are moving. Now you're able to, get up and down the stairs and walk across the room, and you're not feeling the pain that you were before. And then excel is where you're starting to get back to kind of the recreational and higher level things that you wanted to do before, whether it's golf or whether it's playing with your kids or whether it's, inline figure skating, whatever you want to do, whatever floats your boat. And then inspire is about getting even beyond where you were before, right? Making yourself a better person, improving your capacity to achieve higher and greater things, to inspire even yourself and inspire others to achieve more than you ever thought you were able to, right? So maybe it's like you never thought that you would run a marathon. Maybe inspire means that you actually get to run that marathon. Maybe you want to do an Ironman. Maybe you'll achieve that. Maybe something that was so out of the realm of possibility in your own mind was playing, a pickup basketball game for the first time in 30 years. Maybe that's your inspire. But for us, our whole mentality is to get you up that ladder from move. The very basics, the bare minimum of what you should be able to achieve as a human being, we believe is to get you to that move. And then excel is to be able to get you to whatever you really, really want to get back to, right? And inspires to be able to get you beyond where you ever thought you could possibly get to. So that's kind of that what we wanted to share with you guys on this very first podcast. Thank you, Dr. Alex. We're going to be talking a lot more. We're going to spend a lot more time putting out content and information out for you guys. So make sure that you are looking out for our podcast, and we will keep you guys abreast to some more information for future broadcasts coming up pretty soon. We're going to be doing a concussion podcast. There's going to have a ton of information in there. We're going to have a guest on that is extremely knowledgeable and has worked in concussions for many, many years. And we will get more information out to you guys soon. Dr. Alex, do you want to say anything before we end?
No, I'm just, kind of reiterate what you said. We're excited to bring you this content, and we'll keep you up to date on, what's going on that matters most to you guys.
Awesome. Have a good day, guys.